Greetings. I am Christopher Bonner, a member of the Board of Directors for the Mid-Atlantic Group Psychotherapy Society, and I have the privilege of interviewing our 2025 Fall Conference presenter, Dr. Paul LePhuoc, who will be presenting on the cultural mother in group psychotherapy, deepening our engagement with difference. The fall conference will be held in Baltimore, Maryland from Friday, November 7th to Sunday, November 9th, and more details will be shared. You all, I am very excited to introduce our presenter in this interview session that will get us ready for our conference series. Uh, Paulie Fook is a licensed psychologist and a certified group psychotherapist in Houston, Texas, where he maintains a full-time private practice that includes both solo and co-leadership of therapy and training groups. He is a graduate of the Center for Group Studies program in modern analytic group leadership. He is also clinical assistant professor of psychiatry at Baylor College of Medicine and has served on the board of the Houston Group Psychotherapy Society and the International Board for the Certification of Group Psychotherapists for the American Group Psychotherapy Association. He has presented at the local and national level on the topics of race, difference, and psychoanalytic group psychotherapy. Paul and his husband, Jimmy, stay very busy raising their 7-year-old son, Kai, who loves show tunes, art, Legos, and martial arts. I present to you all Paul LeFouque.
A pleasure to be with you,
It
Christopher.
is
Thank you
so
for taking
great
the
to
time.
have you. Thank you so
Mhm.
much. And so, Paul, I just wanted to ask you some couple of questions to engage our listeners as they prepare for the conference series. And but if you could share a bit about your journey as a psychologist and what inspired you to pursue a career in group psychotherapy, and how has your perspective evolved over the years?
Mhm. Happy to spend a little time doing that. I want to reiterate again my appreciation for your thoughtfulness in constructing the questions for this interview. It was really a joy, very rich and a fruitful exercise for me to consider your questions and to get to speak with you today, Christopher. So I appreciate
Oh,
your
very
labor.
grateful.
hmm So I can tell you a little bit in terms of my inspiration for being a psychologist, a group psychotherapist. I started therapy myself as a patient. As I was became a member of my in my own group long before I ever considered um, psychology or group therapy as a profession. I was pretty young. It was 1992, 1993, about 20 years old. And I'm very proud to say this, I'm still a member of that group that I joined over 30 years ago. So it's about 33 years ago that I joined that group. And so I learned from the inside out, just kind of like how I like to think about it. And from the lessons that I learned about myself and the the utility, the healing potential of group therapy that I learned as a patient is what inspired me to pursue a career as a psychologist and a therapist. That's part of the story. I mean, I think that's the most important part that guided my journey.
Thank you so much for sharing that.
hmm
And when we look at some of the personal motivations, especially when we get to the theme of the conference, the cultural mother, what
hmm
inspired your exploration of the concept of the cultural mother and its relevance to group psychotherapy? And could you also share a specific experience that significantly shaped your interest in this topic?
Sure. It's a great question. It's a rich question. And as I kind of warned you when we were chatting before you started the interview, I could talk about this for a while. So I'm going to try to be concise and still provide something of a detailed answer here. Um, I guess one of the best ways for me to start talking about it is that I carry some dimension of difference into most every interaction that I'm a part of. Certainly most clinical interactions that I'm a part of. And by difference, I mean The big kind of demographic, most visible, obvious ones are I'm an Asian American man, I'm a Vietnamese American man. Um, my family came to the US as refugees in 1975. I am a gay man, married to a man. We have a son, and our son he actually just turned 8. That was he turned
Oh,
8 a few weeks ago.
wow.
So
Look at that.
so he just
Time
started
moves
school.
so fast.
Yeah. I was chatting with you that he just started school a couple weeks ago, and so there's a lot of difference that I encounter there. Just as my husband and I are both Vietnamese American, our son's Vietnamese American. So I have a lot of opportunity. Let's put it nicely. I have a lot of opportunities to think about it because it's on my body, it's on my face, it's in a lot of the interactions that I enter into. So it's long been part of my experience. There have been varying degrees of consciousness with which I've had about the difference that I carry and the different kinds of difference that I carry. But a big part of what inspired me to study this more and understand this more is kind of the intersection of that, my body and the way and the way I move through the world and the way I experience the world as a human being, um, as a as a father, as a psychologist, as a therapist, has given me ample opportunity and curiosity about understanding more about um, how this impacts a bunch of different professional theoretical kind of psychotherapy issues. So how does this impact healing? How does this impact the vulnerability to being wounded? um, a whole slew of things, but it's really my lived experience as somebody who embodies a lot of difference that has really been the driving force or the core foundation for my interest.
Thank you so much, Paul, for sharing that insightful answer to
Mm,
that question. And I heard you talk about lived experience, and I'm trying
mm,
to also I'm engaged with thinking about some of the inspirational figures. Who have been some of your biggest influences in your career, and are there any particular mentors or theorists who inspire
hmm
your focus on cultural
Uh-huh.
differences in therapy?
hmm Yeah, I went to town on this one. I had a really long list. I'm like, okay, I don't need to go through all those people. I'll go through some of them. I mean, obviously, the person who I've worked with for many, many years has been very pivotal. My therapist and group therapist has been very pivotal in shaping my thinking and my experience about group therapy more broadly, but also differences in therapy in particular. In terms of theorists, immediately. Um, the people who come to my mind first, if I don't think too much about it, are it's interesting because I noticed this after I jotted it down. 4 women in particular, and they're all Black women, they're all African American women. These are theorists who, in some way or another, have worked and labored to integrate psychoanalytic theory with race, and been very much pioneers in writing about it and thinking about it, making a space for me. To come along and try to be on their shoulders and to use their work to try to extend the work that that they made space for. And Dorothy Holmes is somebody who I believe she might have been in DC for a long time. She was a psychoanalyst, an African American woman. Kimberlyn Leary is a psychoanalyst who I don't think she's practicing anymore. She's in the Boston area now. um, Hortense Spillers, who is not a psychoanalyst, she's a literary theorist. She was at, I can't remember what institution she's at right now, but she is one of the most important thinkers in my mind who's written about psychoanalysis and race. And then Audre Lorde is,
Uh,
um, oh, you know Audre Lorde?
yes.
She's just a powerful poet, novelist, theorist.
Profound writer.
She's, hmm I got goosebumps just now. So yes, and I think the theme for me really is that there are people who are speaking to intersectional spaces that theories of race or theories of gender alone don't cover. And it really, um, my theory that I'm going to present to you all is pretty ambitious. It's in some ways overly ambitious, but what I'm understanding about what these theorists that I've just named have taught me is that I think it's better to try to be overly ambitious in order to try to get at some of the clumsiness or the sloppiness of it. There's not a tidy way to
Mm,
talk about these issues. I'm willing to take the risk of taking on too much to try to capture something or to try to write about something that I think is vital. That if you only talk about sexual orientation, only talk about race, or only talk about gender, it's missing the interconnectedness
mm.
that's so vital to what I think is at the part of what is underneath it all. I'll put it that way. So, so I'll say that, and then there are also psychoanalytic theories. The theory that I'm presenting to you all will be based on the work of Donald Winnicott, who is a psychoanalyst, a British object relations psychoanalyst, and then Frantz Fanon, who is Caribbean, French, Algeria. He ended up claiming Algeria, I think, but he was a Black psychiatrist, educated in the French colonial system that wrote dazzling works on psychoanalysis and race, um, 50s, 60s, and 70s. So I'm trying to contain myself, but you asked, and so I had to
You have me
answer.
very, very excited about some of the names that you have lifted up, and
Mm,
but what also has me excited is just to see the sheer joy that you talk about
mm,
family, and
oh,
to when earlier in a previous question you have lifted up your husband, your child,
mm,
and how has your role as a parent influenced your
mm,
views on cultural differences and acceptance in psychotherapy? And do
mm,
you have any experiences with your son
mm.
help you see these issues in a new light?
Christopher, I'll tell you, this is the question that you asked when I read it. It brought tears to my eyes. So some of them might come out during our interview right now. So, um, it's a great question, such a thoughtful, moving question. Being a parent highlights all these curiosities and puts a point on them and puts a certain degree of poignancy and vulnerability on them like nothing ever has in my life. So I'm going to start babbling in a little bit, but to answer your question, absolutely, my role as a parent has influenced my views, and ma made it so. Let me try. The way I think I can best answer your question is this: one of the ideas that I'm presenting to you all about the cultural mother is this idea, and this is kind of a really quick distillation. We all share a cultural mother who doesn't love her children equally.
Mm,
And I will go into much more detail in the plenaries and the lectures and in the small group discussions that it's what I'm hoping to present to you all is a really nuanced and richly textured way of understanding privilege and oppression, but through a psychoanalytic lens. I have a deep commitment to the idea that psychoanalytic theory, for all of its problems and limitations, has a profound amount to offer um, to those who are interested in unpacking and understanding in a deep and complicated way that oppression works in our society and the structures that we live in. That psychoanalytic theory has a lot of language, a lot of ways of understanding that can be very fruitful and revealing to us. And so the idea of the cultural mother as a mother that we all share who doesn't love her children equally is my hope is that it's a relatable and poignant idea that people can take with them into their practices and into their work. Now, to bring it back to my son Kai, you know, to, it's one thing to experience vulnerability yourself. Boy, it's another thing to experience vulnerability as experienced by your kid. Like if I hear about a kid not a, if Kai comes home from school and says somebody didn't want to play with him, all kinds of feelings get stirred up. You don't want your kid. You want to work. I mean, obviously it's human. It's going to happen. But the idea that he's going to face rejection and hurt in his life is just painful in a different way than I'd ever experienced before becoming a father. So, in as much as what I'm talking about is related to rejection, not being loved less, being loved differently or not at all, it certainly becomes very poignant and quite painful to consider when I think about. Um, my son is a Vietnamese American kid who has two dads, two gay dads. He's adopted. He's going to have some stuff he's going to come up against in his life, and so we're working as best as we can as parents to kind of provide a certain kind of insulation for him, a certain kind of strength that he can carry into the world that can help him know who he is and help protect him, not just from the cultural mother and ways in which society might hurt him, but how, people might hurt him, friends, and so um, the reason why I introduced the idea, and I'm going on for a little bit here, so bear with me. The cultural mother, I think, is an important concept. One of the experiences that I've had in trying to name difference or to put difference in the center of the conversation when we're talking about psychotherapy or group psychotherapy is one of the casualties I've noticed is that sometimes when talking about whatever kind of difference, whether we're talking about racial difference, um, gender identity difference, sexual orientation difference, gender difference, is that sometimes what can happen is we focus on the social and the structural component to a degree that evacuates the subjectivity of the person. Meaning, it's almost as if we're treating folks of color like they didn't have a family that they grew up in. That might have hurt them too. So we want to talk and acknowledge structural difficulty and structural oppression. It's vital. It's been absent from the conversation for so long. We don't want to move it so far that we evacuate
Wow.
the idea that folks have character structures, they have personalities, they have things that, we're not monoliths.
Yes.
And to reduce sometimes the focus, for example, the focus on a microaggression might flatten out the consideration that two siblings, let's just say two Vietnamese American siblings from the same family, might handle that same microaggression very differently. And that might have something to do with their own internal, I don't even know how to talk about it, their reactivity, their defensiveness, or their openness to, like, there's a pliability and there are varying factors that are so important to consider. So what I'm trying to really introduce is that the cultural mother is a very important concept, but we want to consider it alongside family of origin and still do the good work that we know how to do, that we were trained to do, perhaps in a way that to the exclusion of considering difference. We want to try to integrate the two without do a both and. Let's not just focus on the difference to the exclusion of the family dynamics. There's a way to do that. That's the only way to do it. I think when I think about treating my patients or when I think about Kai, you know, as parents, we're going to mess stuff up all the time with our kid. One of the ideas that I work with. Well, let me pause right there because I've been talking for a while.
Oh, Paul, you have really brought some real great excitement out of me,
Oh,
especially
so
a
good
lot
to
of the
hear,
rhetoric that
Christopher.
you've been talking about, especially with looking at oppressive systems and even you're saying breaking down in a palatable way the cultural mother just in this
Hmm.
session. So I can
Hmm.
only envision when it comes down to participant takeaways when we are
Hmm.
actually at the conference together. And so I'm going
Hmm.
to segue to our next question.
Great.
What are some actionable takeaways that participants should be looking to implement in their practice after the conference? And how can these insights lead to tangible improvements in client work?
Such a thoughtful and lovely question, Christopher. The best way I have of answering it, and I'm going to go into a lot more detail in the conference. I think it might sound vague, but I do believe it's actionable. Part of what we're talking about right now when we talk about difference and difference, I like to say it's not difference is a term that can maybe more it's difference as hierarchy, right? Different, it's a difference that has been made into a hierarchy, that some is something, this difference is better than this difference, right? When we're working with these issues in group in particular, but even in an individual dyad or even in different clinical settings, Part of what I want people to take away, which might, I don't know, it might seem obvious, it might not seem obvious, is that there's so much hurt, there is so much pain, and there's so little opportunity to have open dialogue.
Yes.
So, what happens when you don't talk about something and it hurts a lot? It gets pressurized, it gets swollen, it gets primed for the possibility for an explosion because there's a lot of hurt. And if it's not been able to be metabolized, if it's not been, especially when we're talking about cross difference dialogue, cross racial, cross gender, if somebody's like, yeah, I'm going to try to contain my examples here because we're just doing an interview. But um, part of what I want people to realize is the most important thing I want people to take away is in as much as you can, try to slow down. Don't get too ambitious. Clinically, I think a lot of us know this already. If somebody comes into their very first session and they have a tremendous trauma history, say a very difficult sexual trauma history, and they want to dive in and start telling you a lot of details about their trauma, it makes sense. They want to get it out. They want to say what the detail. But the job of a clinician is to try to slow them down because sometimes, especially when it comes to trauma, slower is faster. To slow down the pacing, to really help people understand. I'm not saying don't talk about it, but I want to try to help you talk about it in a way that doesn't re-traumatize you. So
Oh, that
relief.
that is amazing.
Well, appreciate
That
that.
is amazing, and I
Hmm.
really just saying wish that we could just put a brick on top of the acceleration pedal so we can continue to keep on going in this conversation because it's
Hmm.
been so enriching. But I also want to
Oh.
leave just saying this is just a slice of what I anticipate to be a much more enriching dialogue. And so I wanted to come into our closing question
Hmm.
as a closing message for our attendees. And as we just saying, conclude this interview, do you have any final insights to share with our conference attendees?
I'll say this again. I do. And I'll say this again, and I'll probably, it's just one of the guiding principles of the work that I do
Mhm.
broadly, but especially when I speak and present on this topic. I really work with the idea that perfection has very little to do with closeness and intimacy. So I'm not going to get it perfect. I don't want people to come to this conference with the pressure that they need to be perfect, that they can't make mistakes, that they have to do things exactly the right way, or that there are going to be some high stakes and that they're going to get in trouble or get kicked out if they think the wrong thing or say the wrong thing. So, having said that, I also want to add that alongside that, the idea that make mistakes, you can't be perfect. Perfection has very little to do with closeness. The other thing that I add is as you work in your imperfection, try to be open to people's reactions, all of their reactions, their emotional reactions, because people are going to have reactions um, when something that's said wounds them. That doesn't mean you shouldn't have said it. You should have kept it to yourself. It means we have to try to work towards having a space where there's a little bit more of a possibility for making mistakes and for repairing. And that easing up and constricting and walking on eggshells doesn't help anybody. That's just that means you have to split off. It's a very unpleasant experience. It's not growth inducing. It's not constructive. So perfection has very little to do with closeness. Don't try to be perfect, but also as you're trying to be yourself and not and be open to your imperfection, be open to people's reactions to it. And I'll be there trying to help people work with all the imperfections that come out, all the emotions that come out. I work really hard to try to pay attention to the larger group and all the different feelings because it's a stirring topic. Healing is elusive. And so people have big feelings. So,
Paul, I'm definitely very excited for our upcoming conference. So thank you so much for taking your time
mm,
to share with our attendees and viewers.
Mm,
the excitement that we definitely all share with the Fall 2025 conference that's coming up. Again, those dates are from Friday, November 7th to November 9th, and it will be taking place in Baltimore, Maryland, and registration information be shared shortly. Again, Paul, thank you so much for expounding so much about the cultural mother, making it so palatable for all of us in
mm.
this setting, and having something to very much look forward to. And again, thank you. Truly appreciate you this evening.
Thank you, Christopher. Appreciate all of your labor and work and your presence and open-heartedness.
Oh,
So
thank you
thank you.
so much.
Look forward to meeting you in person.
Likewise.